to let you know that Dr. Davis joined the meeting and he is on the call that begins with the 7:06. Good morning,
Thank
Chair.
you.
Thank you. Chairman, we can begin.
Yeah, would you call the roll, please, Tanisha?
Yes. Norman Boyd,
Here.
Russell Crutchfield,
Present.
Anthony Williamson,
Here.
Cynthia Rucker,
Here.
Nelva Lee,
Here.
Kenneth Davis,
Here.
sorry, one second. Could you repeat again, Dr. Davis? Sorry.
I'm here. Yes.
Thank you. Russell Crutchfield,
Here.
Roger Folsom,
Here.
Chairman Boyd, that concludes my roll call. Did I miss someone?
Is David Cruz on?
Oh, I'm sorry, Mr. Cruz.
I think
David
we had
Cruz.
everybody but David. Are you here, David? Okay, guess not. Okay, we do have a quorum, and thank you all for joining the meeting this morning. We have, and I will call the meeting to order at this time. We have a fairly full agenda here with 6 different items that we're going to be asked to vote on as a board for initial adoption, and we'll move into those presentations. But first of all, I'd like to call on Russell Crutchfield, our secretary, and see if he has reviewed the minutes of the May 12 meeting and can recommend those for approval.
Well, good morning, Mr. Chairman. I have reviewed the board meeting minutes from the May 12th board meeting, and I have found them to be correct and in order. And I move for approval of the May 12th board meeting minutes.
The minutes have been recommended for approval. Is there a second to that, please?
This is David Cruz. I am present and I
Okay. Welcome, David, and thank you for seconding that motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, the minutes are approved. Thank you very much, Russell. And at this time, we'll move to the commissioner's report. So Commissioner Nagel, please.
Good morning, Mr. Chairman. Good morning, members of the board. Thanks for being with us today. As you can see from the agenda, we have a couple of additional notable items today. The countdown to July 1 has really begun. The end of our fiscal year and the beginning of what we hope to be several new valuable benefits to our members and to our providers, several of which the action items today will support. First, you'll hear Lynette Rhodes present our estate plan amendment to end our existing postpartum coverage waiver and replace it with a state plan amendment to extend postpartum coverage in Georgia to 12 months. This effort was really championed by both Governor Kemp and Senator Chairman Dean Burke over the last year or so, and we really look forward to implementing this and being one of the states that are now expanding that maternal health care coverage postpartum upon CMS approval. You'll hear 3 action items today presented for initial adoption from Brian Lipton as part of our ongoing effort to implement a series of directed payment programs that we've talked about over the last few months this spring. We are hoping to get, and thank you for your flexibility, we're hoping to get all of these through initial public comment and adoption, and hopefully through final, most of them by the end of June, so that if CMS ultimately approves them, they'll be effective retroactively back to July 1st. So we appreciate your flexibility. We will, I think, plan on having a second board meeting in the month of June on June 27th so that we can meet that deadline. And again, what you'll hear today are additional directed payment program components, part of our bigger picture program that will ultimately increase provider rates paid to hospitals, focusing on our quality strategy and in alignment with that, focusing on both quality, ultimately reinvesting 50 to 100 million in our healthcare workforce, and significantly reducing overall uncompensated care costs in the state and nearly completely eliminating uncompensated care costs for our rural hospitals around the state. So we look forward to continuing to move these action items through and hopefully receiving CMS approval during the course of the next year, which will be a huge win for healthcare in Georgia. A couple operational notes. We've talked about the upcoming CMO or managed care reprocurement, and that work is ongoing. In fact, we are anticipating issuing an RFI or request for information as early as tomorrow as we begin our effort to seek stakeholder and advocacy organization feedback and input. We're inviting any interested party, not just potential vendors, to submit their feedback through that RFI process. That RFI will be posted obviously on DOAS's state procurement page, but also on our website and through other means as well. We'll also be reaching out to our sister health agencies and several advocacy organizations around the state to really schedule and curate some conversations about so that we can get their feedback as well on what we all want to see in terms of outcomes and priorities in the next round of managed care. The state health benefit plan has been out in the field and hard at work, getting out in front of their members at many different conferences and associations and getting in front of our members and sharing information over the past few months. I've heard great feedback on their attendance at those events. It's early, but open enrollment is already being planned for plan year 23, and that'll start on October 17th this year. We're anticipating very minimal changes to the plan design this year. And as you know, we'll be sure to present all those changes to you, I believe, at our August board meeting. We did receive CMS approval of a pending state plan amendment related to our nursing home payments and cost reports, which included our new quality incentive payment program. I believe it was just about 2 weeks ago, week and a half ago. I'd like to extend special thanks to Kim Morris and the entire reimbursement team and finance for working super expeditiously to get some cash out the door, and payments should be hitting our nursing home and long-term care partners this week. I know that'll be much appreciated. We still have an additional disaster spa pending that's also related to FY22 rates for those same providers, and we're hoping that we'll get that final approval in the next few weeks and can get some additional funding to those providers as well. We've received notification from the Department of Audits of 2 special exams that they'll conduct within the department over the next few months, one on SHPP and one on our planning for the unwinding of the public health emergency. As you know, the federal public health emergency is ongoing. It was slated to end July 16th, I believe. CMS has reaffirmed their commitment to giving states 60 days advance notice before they end it. We are within that 60-day window and have not received that notice. So it is pretty much commonly assumed at this point that we're going to be extended beyond July, the middle of July. And more we're hearing rumors and confidence that it's likely to extend at least until October, if not the end of the calendar year. So planning is a bit tricky with a moving target, but we are working very closely with Commissioner Brose and her team at DHS and DFACS to do all the things necessary that will be required to redetermine eligibility, Medicaid eligibility for our over 2.5 million Medicaid members. One thing's for certain, you'll certainly start to hear and see increased communications from both of our departments in the coming days, encouraging members to update their contact information. That's going to be critical as we work to redetermine eligibility. DCH will also have some additional items to consider. There were a number of flexibilities and waivers that we put into place related to telehealth. We've been waiving copays and premiums for many of our members in certain programs. And so we'll have some decision points around whether or not to continue or end those flexibilities as we move on once that PHE ends. But we'll keep you updated on those plans and look forward to working with the Department of Audits on both of those exams. And finally, I had the opportunity to speak to a couple groups over the last month. I want to thank them for their invitation and that opportunity. Got to spend some time with Jimmy Lewis and his team at Hometown Health, as well as GHA over the past few weeks, and certainly enjoyed my time there. And I'm looking forward to spending some additional time over the coming week with our long-term care community at the GHCA convention, as well as some other engagements in June. So look forward to getting out and visiting with some of our constituents in the coming days. Happy to answer any questions, but that concludes my report.
Thank you, Commissioner. Are there any questions for the Commissioner or comments, please? Hearing none. Thank you for that report, and look forward to the many positive things that you talked about. First of all, on the agenda today for items that we're being asked to consider for initial adoption, I'll call on Lynette Rhodes, Executive Director of Medical Assistance Plans, and I think Lynette has 3 different areas to present. And you may move into those now. Thank you.
Thank you. Good morning, Chairman Boyd, Commissioner, and members of the board. Thank you for the opportunity to present. The first item that we will be presenting relates to the termination of Georgia's postpartum extension waiver and notice to extend postpartum services to 12 months under the state plan. Pending Centers for Medicare and Medicaid Services approval, the Department of Community Health proposes to terminate its postpartum extension waiver, which extends postpartum services to 6 months or 180 days. Upon receiving approval from CMS, the department will extend postpartum services to 12 months under the state plan. In accordance with the special terms and conditions outlined in our 1115 demonstration, the department is now issuing notice in order to solicit input on the proposed changes. Interested parties will have a period of 30 calendar days from the date this notice is posted to provide comments on the proposed termination of the 1115 waiver, the transition and phase out plan, and the proposed extension to 12 months. I will address the changes in two parts, Chairman Boyd. I'll start with the termination of the postpartum extension waiver first. As noted, we're proposing to terminate our existing 1115 waiver. We submitted an application to CMS on December the 11th, 2020, and received approval on April 16th, 2021. The existing waiver extends postpartum services from 60 days to 6 months or 180 days. We are proposing to terminate this 1115 waiver effective October 31st for the following reasons. First is that the current waiver allows postpartum services for 6 months. Per the provisions of the American Rescue Plan Act, which was signed into law in March of 2021, states now have the option to extend postpartum services to 12 months. And we have opted to extend services accordingly. The eligibility groups will remain the same under the state plan. CMS must approve our transition and phase out plan before we can actually begin implementation. Additionally, CMS must approve our state plan amendment extending services to 12 months. Our transition and phase out plan includes various components. One is the submission of a state plan amendment, which Commissioner Noggle mentioned. We will have to notify impacted members of the change. We are proposing to notify members via US mail and also through direct member outreach. A copy of the draft notice that will be sent to members is attached to the public notice as Appendix A. We will also post notice on the DCH webpage, the CMO's member web pages, the GAMA system, and the Gateway system. We will engage external stakeholders, provider associations, and advocacy groups. We will also conduct eligibility redeterminations prior to the termination of the demonstration waiver for all impacted members to ensure ongoing coverage for all eligible beneficiaries. We will also check to see if members are eligible for any other categories of service prior to termination and whether or not those individuals qualify for services under the marketplace. The Medicaid benefit package will not change. There is no cost sharing, co-payment, or co-insurance. Members who are enrolled with the care management organization will continue to be enrolled with their CMO. Members who are enrolled in aged, blind, or disabled or fee-for-service will continue to be enrolled in that traditional Medicaid plan. I will now address the 12-month postpartum transition. Pending approval from the Centers for Medicare and Medicaid Services, the department proposes again to extend services to 12 months. The fiscal impact is as follows. Total funds represents $85,020,107. Of the total funds, state funds represents $27,395,603. Federal funds represents $57,624,504. That's the fiscal impact for state fiscal year 2023. For state fiscal year 2024, the fiscal impact is as follows. Total funds represents $87,535,512. Of this amount, state funds represents $29,744,567, and federal funds represents $57,790,945. There will be two opportunities for public comment in this instance. The first opportunity for public comment will be held on June the 6th at 11 o'clock a.m. via Zoom. The second opportunity for public comment will be held on June the 9th at 11 o'clock a.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before July the 1st, 2022. Chairman, I will pause now for any questions from the board.
Any questions or comments from the board for Lynette, please?
I do have one comment. I really appreciate hearing that those that are deemed ineligible by the state will have other programs looked at to help them.
Yes, that's our normal process. So when we terminate, we're going to check to see if they qualify for any other category of service. And if not, then we will do our normal process of transitioning over to the marketplace.
Any other questions, comments? Lynette, before we ask for a recommendation or approval here, I assume that one vote is necessary to cover both the termination and the extension. Is that correct?
That's correct.
Okay. Hearing that, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Motion's been made by Mr. Folsom for approval. Is there a second?
Second, Cynthia Rucker.
There is a second from Dr. Rucker. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lynette, thank you very much.
Thank you.
And you may move on.
Okay, second item for presentation today is the renewal of the New Options Waiver Program, which is a home and community-based services program. Pending approval from the Centers for Medicare and Medicaid Services, the department is proposing to renew its current waiver for the New Options Waiver Program, which expires on November the 8th, 2022. We are requesting a 5-year renewal of this program effective November the 9th, 2022. The public notice provides details about the waiver renewal application and serves to open the 30-day public comment period, which closes on Friday, July 1st, 2022. The department proposes the following changes in the now renewal. First is to modify the eligibility minimum age. Second is to add assistive technology as a new service. Third is to modify the following services to reflect telehealth service delivery. Those 5 services include, the services include adult speech and language, adult physical therapy, adult occupational therapy, nutrition services, interpreter services, behavior support services, and supported employment. So all of these services will now be able to be rendered via telehealth. We will allow 2 services with low utilization to expire. Those services are the community guide and natural support training. Next, we will remove participant direction or self-direction as a service model for 2 services. First is behavioral support services. Second is supported employment. And finally, we intend to request a permanent rate increase of 7%. The public notice document includes a complete listing of the services, the current rates, and the proposed revised rates. In terms of additional information about the changes, we're proposing again to add assistive technology as a new service. This consists of any technology, whether acquired commercially, modified, or customized, that is used to maintain or improve functional capabilities of individuals with disabilities in the community. Again, I mentioned the services that would now be available via telehealth, so I will not repeat those. We are allowing the following services to expire: community guide services. We're allowing this service to expire due to low utilization. The community guide services assist waiver members in managing self-directed services and responsibilities. The support coordination and fiscal support services agencies will now provide the functions of the community guide. So there is an alternative available there. In terms of natural support training, again, this is another service that we are allowing to expire due to low utilization. The support coordination and fiscal intermediary roles encompass much of what is meant by the current service definition and will continue to assist individuals with researching and providing alternative resources in the community. The fiscal impact for these changes is as follows. Again, this is a 5-year waiver renewal. So this fiscal impact encompasses the cost for all 5 years. The total fiscal impact is $352,440,697. Of this amount, the state share represents $119,759,349. The federal share represents $232,681,348. An opportunity for public comment will be held on June the 6th at 12:00 p.m. via Zoom. Individuals wishing to provide written comments must do so on or before July the 1st. Chairman, I will pause now for any questions from the board.
Any questions, comments from the board? Lynette, just curious, what is it? Why did we request this for 5 years? Why
That's-
5 years?
That's our standard. These waivers typically run for a full 5 years. And so as we're
Okay.
approaching that deadline or expiration date, we're wanting to keep this service. It's definitely needed in the community as a home and community-based option.
So it's consistent with what would be expected for CMS approval.
Oh,
is that
absolutely.
right?
Yes, sir.
Okay, I just wondered why it wouldn't be open-ended, for example, on,
Yeah, they limit it to just 5 years. So every 5 years we have to renew.
okay. Any other questions, comments from the board? Hearing none, is there a motion for approval for initial adoption?
Dr. Lee, motion to approve.
Okay, Dr. Lee has made the motion to approve. Is there a second?
Russell Crutchfield will second.
Russell Crutchfield has seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and you may proceed to your next area, Lynette.
Okay, thank you, Chairman. The final request that I will be presenting this morning is a request for approval to renew the Elderly and Disabled Waiver Program. This is another home and community-based services program. The current approval for the Elderly and Disabled Waiver Program is set to expire on November the 8th of this year. The Elderly and Disabled Waiver Program encompasses two programs. It includes the Community Care Services Program and the Service Options Using Resources for Community Environments, also known as SOURCE. We are requesting a 5-year renewal of the program effective November the 9th of 2022. The public notice provides details about the waiver renewal application and serves to open up the 30-day public comment period, which closes on Friday, July the 1st of 2022. We are proposing the following changes in the Elderly and Disabled Waiver Program renewal. We are adding assistive technology as a new service. We are modifying personal support services to allow a relative to deliver the services. We are allowing 5 services with no utilization to expire. Those services are transition coordination, pre-discharge, transition coordination months 1 through 6, transition coordinations months 7 through 12, transition supports, transition services and supports, and transition community integration services. And finally, we are proposing a 10% rate increase for all services across the board. A complete listing of the services, the current rates, and the proposed rates is included in the public notice document. As with the previous waiver, assistive technology, again, consists of any technology, whether acquired commercially, modified, or customized, that is used to maintain or improve functional capabilities of persons in the community. So that is a new service that we're proposing to add. We're also modifying personal support services to allow a relative to deliver the service. This is due in part to the staffing shortages in the community. And this will ensure that our members continue to receive services. These family members or other paid caregivers will be employed with an agency, and there will be monitoring and oversight. In terms of the fiscal impact, again, this is a 5-year waiver renewal. So the total impact for the full 5 years is $5,331,467,140. Of this amount, the state share represents $1,811,632,536. The estimated federal share represents $3,519,834,607. An opportunity for public comment will be held on June the 7th, 2022 at 10:30 a.m. And individuals wishing to provide written comments must do so on or before July the 1st of 2022. Chairman, I will pause for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
This is David Cruz. I move for initial adoption.
David Cruz has made a motion for approval for initial adoption. Is there a second?
Second.
Roger Folsom, second.
Roger Folsom has seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lynette, thank you very much. And
Thank you.
we'll look forward to getting the public comment on
Yes.
all of these. And you'll be back to us for final approval or after those modifications if needed.
Thank you. Have a great day.
Thank you. Next in our agenda today are 3 items to consider, and Brian Lipton, Senior Policy Advisor, will make that presentation. Brian, you may proceed.
Thank you, Mr. Chairman, and good morning to you and to members of the board. Great to be with you here today. I'll be presenting 3 items and wanted to offer some brief background before we move into the first item, as these items are interrelated. And I apologize in advance if I echo some of the comments made by Commissioner Noggle. The Department of Community Health is currently pursuing a new Medicaid Innovation Advancement Project to increase available Medicaid revenue dollars through CMS approval of a series of state-directed payment programs, or DPPs, state plan amendments, and department rule changes. The overall project goals include leveraging additional federal Medicaid funding, supporting rural hospitals and bolstering rural access to care, reducing costs through appropriate level of care utilization, improving health outcomes and equity, and expanding healthcare training and workforce investments. Deputy Commissioner Loke previously presented the first step in this process, advancing innovation to deliver equity, or Georgia Aid. And in addition to the 3 items here today, I'll be back later this month to present one more final component related to the Disproportionate Share Hospital Program, also known as DSH. If all components are approved by CMS, Georgia and the Department of Community Health will eliminate 100% or very near 100% of uncompensated care costs at all small rural hospitals, cut the overall level of uncompensated care in Georgia by nearly 50%, reinvest approximately $50 to $100 million in the healthcare workforce. With that, sir, I'll move into our first item. That would be Medicaid care management organizations, hospital-directed payment programs for private hospitals. Pending CMS approval, DCH proposes implementing a hospital state-directed payment program in July 1, 2022 for eligible private hospitals. Eligible private hospitals are defined as all private acute hospitals, excluding general cancer hospitals, freestanding children's hospitals, and rehabilitative, psychiatric, and long-term acute hospitals. All critical access hospitals are also excluded. The state-directed payment will be based on the difference between the aggregate provider Medicare reimbursement and Medicaid payments for the same providers using state fiscal year 2021 upper payment limit calculations. The resulting percentage increase derived from these UPL calculations will be applied to all eligible participating providers' CMO claims to calculate the state-directed provider payment amounts. The state-directed payment will be made to CMOs, and the CMOs will be required to transfer the payment to the eligible participating providers. The CMO reimbursement plus state-directed payments will not exceed 100% of Medicare in aggregate. Public providers are currently eligible for these rates, so this proposal would establish equity with the public hospitals by extending eligibility to private hospitals. The total estimated funding increase in state fiscal year 2023 is $153,226,590, of which $51,748,450 are state funds and $101,478,140 are federal funds. The state funding amount required to obtain federal financial participation will be funded through provider payments, which we will discuss more in our third item. An opportunity for public comment will be held on Tuesday, June 7th at 11:30 a.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes can do so on or before June 14th, 2022. I respectfully ask for the board's favorable consideration of this item for initial adoption, and we'll pause here for any questions.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Russell Crutchfield move for approval.
Russell Crutchfield will move for approval. Is there a second?
Dr. Lee will second.
Motion has been made and seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and you may move on, Brian. Thank you.
Thank you, Mr. Chair. Our second item is strengthening the reinvestment of a necessary workforce in Georgia, which we're calling STRONG. Pending CMS approval, DCH proposes implementing this new hospital state-directed payment program to focus on stabilization, development, and diversification of the healthcare workforce, leading to improved health outcomes for Medicaid members. Eligible hospitals are defined as teaching hospitals with at least 5 resident full-time equivalents based on Schedule E, Part A, lines 10, 11, and 16 in the 2019 Medicare cost reports, excluding teaching hospitals participating in Georgia Aid. This will initially include 21 eligible teaching hospitals, and those hospitals will be required to submit a robust annual evaluation created in conjunction with representatives from those hospitals. The strong payments represent a 200% increase to the hospital-based Medicaid reimbursement, which is less than the difference between 100% of the commercial reimbursement and Medicaid-based payments. The total estimated funding increase in state fiscal year 2023 is $746,391,501, of which $252,075,070 are state funds, $494,316,432 are federal funds. The state funding required to obtain federal financial participation will be funded at public hospitals via intergovernmental transfer and at private hospitals through provider payments. And the teaching hospitals have verbally agreed to reinvest 10 to 20% of the new federal funds into workforce development, which should equate to approximately $50 to $100 million. An opportunity for public comment will be held on Wednesday, June 8th at 11:30 or at 11 a.m. via Zoom. Individuals wishing to comment in writing can do so on or before June 15th, 2022. And I will respectfully ask for the board's favorable consideration of this item for initial adoption and pause here for questions.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Also, Crutchfield will move for approval.
Mr. Crutchfield has moved for approval for initial adoption. Is there a second?
Second from David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? It is approved. Brian, you may move to your next item.
Thank you, sir. Our final item is a administrative rule change. The proposed rule change amend the rules and regulations for medical assistance in rules and regulations section 111-3 to create a new section 111-3-11 hospital directed payment programs. These changes establish a new hospital provider payment program pursuant to the authority granted to the department in OCGA section 38-8-179.2. Such payments will provide this necessary funding to obtain federal financial participation for the two state-directed payment programs presented here today, the hospital-directed payment program for private providers and Georgia Strong, pending CMS approval. Provider payments under this rule shall only be used for the specific purpose of hospital-directed payment programs, and the amount shall not exceed the amount necessary to obtain federal financial participation. The amount of each non-governmental hospital provider payment shall be determined by the department using available hospital financial data and other information as applicable, including but not limited to hospital cost reports and the annual hospital financial survey. An opportunity for public comment will be held on Wednesday, June 8th at 10 a.m. Zoom. I respectfully ask for the board's favorable consideration of this item for initial adoption. We'll pause here for any questions.
Any questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Roger Folsom has made the motion for approval. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, they are approved. Brian, just might add a little more comment because these areas that you've covered are should be viewed as very, very positive, and there's a lot of money here going out into the provider network, and particularly your comments about rural hospitals and big concern in this state is rightfully so. Any more color around this that I would think that when we go out, public comment should be fairly well received, wouldn't you think?
Yes, sir, absolutely. Actually, if you allow me just a couple more minutes, I
Yeah,
want to
please.
acknowledge a couple of the folks that have worked on this with us. I'd like to thank everyone has participated and contributed to the success of this project. This includes a team of interdepartmental DCH staff, consultants, actuaries, and several of our external partners. Especially want to acknowledge the hard work, support, and leadership of a few folks Carrie Summers, Carrie Conley, and Anna Adams of the Georgia Hospital Association, who have been instrumental in moving these projects forward. Chairwoman Dr. Mary Chapman, and all members of the Teaching Hospital Workforce Committee, which would include all eligible participants in the Georgia Strong program, which was also favorably received by all of those participants. And then by our internal DCH staff, Lynette Rhodes, Executive Director of Medical Assistant Plan Division and her team, Kim Morris, Director of Reimbursement and her team, Rich Kim, Budget Director and his team, and then Senior Advisor Joe Hood. But so far, everyone that we presented to has been very supportive and excited about these initiatives.
Very good, Brian. We'll look forward to the public comment and coming back and readdressing this after that time. Thank you so much.
Thank you, Mr. Chair.
At this time, is there anyone who knows of any new business that should come before the board at this time? Hearing none, I'll remind you that we are this month having two meetings and the special meeting being called for June 27. And that is, as Commissioner covered earlier, we need to address these items in final approvals to be able to implement in a timely manner. So we're doing that. And also just a reminder, and Tanisha sent us all an email changing the date of the July meeting to an unusual date of a Monday of July 18. And that's to accommodate scheduling again. So with that, with no other new business to come before the board, I thank all of you for being on the call today, and this meeting is adjourned. Thank you.
Thank you.